he's doing very good.
You don't feel good? What's your symptoms?
Got a bad headache.
Is there any nutrition class?
Not here, but look at the front of the little TV screen up front.
Oh,
That'll tell you what room it's in. I didn't call. But Gene says nobody called the whole year I was gone.
That's right.
Just make sure, I guess we call for next time.
Oh, yeah, definitely.
Yeah, or else we get in
Well,
trouble.
didn't you want to talk to him about a big room? For the big party?
We've only been trying to get a hold of you for a year.
Oh, you're kidding. Why?
You know what?
He doesn't answer?
No, we keep missing. I mean, either he can't make it, we can't make it. He doesn't return calls.
He doesn't return phone calls?
Then we forget and just start up.
Just call up and say, this is Mr. Jones from the IRS. I need to speak to you. You'll get him.
Yeah.
Yeah.
It's the sheriff's office.
Ah.
Did you guys do a new schedule for January? Did you discuss it or anything?
Why, do we have one?
No,
No.
I don't have one.
No.
We
That's my
talked about the
point.
meeting, but I don't think we took it.
We've discussed it, but I don't think it's been put together yet, or been put on
I think I was
paper.
supposed to give these out to you too, and I didn't realize it.
Pat won't be here. She's got. has to
I mean, I left work at 12 o'clock today because I went home and went to bed.
Oh, go, go.
I got up to come in here.
That's great.
Yeah.
What's your last name, Dan?
I'll just take the box,
Just
right?
stand up and say, oh.
Yeah. I'm just,
Sign way in there. Oops, oh, what room did you look in? Boardroom? Yeah. I'll tell you. I'm not on the schedule, so we're just gonna use this room. So we're gonna try.
What's that tell you? It's called flip.
set up.
Should we at least move one table, as long as we remember what.
Or if you have email, you prefer to email.
I end up not going over there very often.
Okay, then just your address, will make sure you get a card.
Take this way, and we'll take it in. I remember the wrong way.
What is that, 807.5? For real?
For real, and you see, look
thank
on
you.
the old glass that's hidden behind some wallboard and stuff, it says 807.5.
How about that?
it's blank and blank.
Blank and blank?
Blank and blank.
Mr. Blank?
Yeah, right here.
Andrew Boyle.
Okay.
AB. That's
All right.
a great initials.
Thank you, AB. Well, that you guys were here and I didn't have a paper and I could put you guys in this room.
Thank you so
Okay.
much for taking care of us.
All right. Appreciate it.
Where's our coffee at?
We're lucky we got room.
Well,
Is there a time when the movie is going to actually be presented?
Yeah, if we can get it together. What we're doing this for is because, you know, for 10 years we've had people trying to get us to write a book.
No, I
Can't do it.
I think it's a
So-
good historical
So we
record kind of.
figure we can get everything in a video and we don't have to do the books.
God, that's scary.
But we'll see.
Do a lot of, collect a lot of stuff and then edit
Yeah.
it together.
Yeah, so it's going to turn out like a collage, I guess.
Yeah, 'cause somebody real angry and then they erase all the filming that it does, but like, oh,
Where? Pick on the door there? Oh, here, put them in. Or something. Yeah, yes, that's well.
When they work, yeah, when they work. Are we ground zero for ADD
What do you mean by that?
organization? I mean, are we the?
Well, to send her, well, they didn't have the money then.
Oh, I see. They paid for it.
Of course, now he's sent me an e-ticket, but now I have the money. So I'm gonna take some money back over and give it to him.
Oh, that's nice.
He doesn't know it
Yeah?
yet. When? Yeah.
What do you do?
She says, well, when we get there, you'll get, so you get your suitcases by this time. We're gonna take you over to this place here for dinner. It's a real nice place, you know, you'll like that. And then the next day, we're going snorkeling.
You like snorkeling?
We didn't have.
Yeah, it's all right.
I'm not too thrilled with it, but a lot of people like it.
I went right to the other room,
Yeah,
like I knew where I was going.
Yeah.
Maybe you wouldn't make it.
Never crossed my mind.
Pardon me?
Never crossed my mind.
We didn't even have a room, they just gave us this.
Trust
Set
me.
up on Mars if we keep it moving.
Right.
Well, we hit it on the way.
Yeah, there. She didn't know.
Stick.
I mean, you hit it while you were in
Well,
the air.
as we took off. No, as we took off.
It bent up.
The front wheel.
Oh, oh, oh. as far as it's still down.
We want to get started before all the seats are taken. So,
And we're all ears.
what we're going to do is we're going to sit up here as a panel. So if you want to come up closer, then it'd just be easier to interact. Topic is tonight. The topic is how to choose an AED professional, which can be a physician or it can be a psychologist or a learning consultant or whomever. How do you choose the people that you're going to be working with? Again, this is ADDventure. Everybody kind of knows that. I don't think I need to go through that. The information that we share with everyone shouldn't be considered as the gospel. It's our opinion. It's our experiences. Take the information that value. Please don't change your medication or your treatment without checking with your physician and the person who's in charge of your treatment. Okay? So what I'd like to do is we have a reduced panel tonight. First of all, we have two people that can't be here this evening. So do you want to be on the panel?
Not right now, a little while.
You can come up then after we get started then.
Yeah.
Okay.
No doubt.
All right. So will you want to introduce yourself to everyone?
I forget. I'm Jan Gibson.
Pardon me, what's your first name?
Jan, J-A-N. Yeah.
Jake Gibson. He's part of the executive steering committee or
Executive Board.
executive board, yes. And
Yeah, I'm Barry Klieger, and I'm on the executive board. I sort of took over for my son when he got married. He got too busy, so I came onto the board at that point.
And I'm Ed Forniscus, and been with the group now for, well, it'll be 10 years, and we're going to have, next month will be our 10-year birthday party. So make sure you all come out for that. I'm sure that'll be very interesting. Okay, the topic tonight is how to choose an ADD professional. And what we did at our last meeting, our exec meeting, is we went around and we kind of told our own personal stories about how we came across people to work with that were professionals. So I guess I'll start it out. The way I got in touch with professionals was I'd worked in the field of special education and education for quite some time, so I was familiar with a little bit about ADD. ADD was relatively new, approximately 10 years ago. And Linda, my wife, had really gotten interested in the ADD, so that spurred my, interest in it also. So we did a lot of research, and in doing the research, we began to see that, as many people do, that their children were having some of these difficulties. So through our children, then we came connected with some physicians. The way that I really got connected with the person that I'm working with now was I knew this gentleman when I was younger and when he was younger, and he wasn't a doctor, so we had a connection there. So it was kind of unique that I had a kind of a friend who was becoming a physician at the time that ADD was becoming popular, and that's kind of how it kind of worked for me. We also, the way that we found the physicians and the professionals to work with our children was, again, basically through word of mouth back then. And it was more looking for people who had an interest in this particular area. Some of the physicians back then didn't want to get involved with it, and there's some physicians today that don't want to get involved with it because it's not monetarily rewarding to have a lot of ADD people in your practice because they take too much time. They take follow-up phone calls, they present with additional problems. So it's not the 5 or 10 minute in and out patient that a lot of docs like to deal with. So there are some physicians out there that will just refuse to take any ADD patients. So in looking for a professional, obviously you need to look for someone who has some type of interest in this or desire to be involved with it. The individual that was working with our children had children who also had ADD. So we connect with that person because that person had a familial interest in this, which made it very interesting for us because his treatment was the treatment our children were receiving, and we felt if he's working this way with his children, then there's a good probability this is one of the best accepted methods. Jan or Barry, would you want to explain how you kind of connected with whomever, or how the family connected?
Yes, my wife is ADD. In fact, she's ADHD. Actually, this came up when she wanted to go to college. Right? Well, she, shall we say, had all the B and C courses in high school. She had no formal training. She didn't have anything past add and subtract and math. So when she was going to school, I was doing the tutoring. So I tutored and tutored and tutored, and she found it very, very difficult, especially math. So anyhow, going along with this, we finally decided this is really, really hard. You know, something's wrong. So a friend of hers said she had just read this book. It turns out to be Driven to Distraction by Hallowell. And she read it. And it was like I guess a rude awakening because she said, this book is me. How she got in touch with Ed and Linda, I'm not positive. Do you remember Ed? I'm not positive. But anyhow, she contacted Linda, and she went through it took about a year, I guess, to get her on track with the medicine. And once she got on track with the medicine, it was like a light bulb went on. All of a sudden, my tutoring went from 3 hours a night to 2 hours to 1 hour to only twice a week. And that was always in subjects like math and statistics. Without that medicine, she could have never done it. But she actually got her associate's degree, went to Rowan and graduated with a degree in psychology, and she now teaches. So our story is, I guess, a pretty good one because we didn't have to do a lot of searching, you know. Getting in touch with Ed and Linda worked out really great because they do a fantastic testing, not like we hear now from other doctors that, you know, you walk in and 10 minutes later they tell you you're ADD. Well, that's not possible. It can't be done in 10 minutes. It's going to take at least 3 or 4 hours of testing. And then you've got to put them on the right medicine to find out if you're ADD or if you have something else. It could be a comorbid thing. You could be depressed. Or you could just have learning disabilities. So anyhow, she did utilize the 504 and ended up in school because she couldn't get her brain fired properly because she's under time restriction. So she was put into a room similar to this. It was called a testing room. And they said, whenever you're done, just let me know. And her grades went. She made Dean's List. She got a scholarship.
They have 504 for college?
Oh, yeah.
You know they have it.
Oh, yeah. She was never time tested. When it was time for her to take her test, they gave her an appointment to go to the testing facility. And then you sign in, and they give you the test, and whenever you're done, you're done. When that facilitator there is done, another person comes in. So, you know, a 2-hour test might take her 4. But her grades went from, you know, D's to A's just by having that extra time, knowing, hey, I got it all day. So it worked out great.
I had a long history with ADD because my son, who's 27 years of age, his name is Josh, and when he was about 3 or so, my wife started talking to me about, you know, there's something with Josh, you know, I'm concerned, you know, it was showing up socially, you know, he was not mixing with other kids that well. He wasn't, you know, giving them a hard time, but he was sort of an isolate. And then it took my wife about a year to work on me until I agreed to have my son evaluated, which is somewhat ironic given the fact that I'm in the mental health field. I'm a licensed clinical social worker. And I kept saying there's nothing wrong with my son. You know, I didn't quite say it that way, but that's what I was feeling. But she prevailed, fortunately for my son. And at that time, we were living in North Jersey, so we made an appointment to go to Columbia Neuropsychiatric Institute, which, if any of you are familiar with New York City, it's right across the George Washington Bridge. I don't know how we got recommended to go there, but it has a stellar reputation. It has for years, and probably the pediatrician suggested it. And we took him there, and the psychologist who specialized in evaluating kids for ADD, learning disabilities, said, well, I think she just sort of took one look at him, and even though Gene said you cannot, and it's true, you cannot evaluate somebody in 15 minutes, she took one look at him, and given her experience, she said, I think I know what I'm going to find, but we'll do the testing. And she did the testing, and it took a couple of hours, and I think we came back a second time. And there was no doubt that he had attention deficit disorder, hyperactive type. Although in those days, I don't think they made a distinction between ADHD and ADD without hyperactivity. He was started on Ritalin. And that was an interesting experience because he was afraid to swallow the pill, and even at the age of 4.5, he had a good amount of insight, and he was saying things like, if I take this pill, am I going to change into a different person? You know, he was afraid of what it was going to do to him. And we knew of another family who had an ADD son, and we said, why don't you call Dennis? So my son got on the phone with Dennis, and Dennis had been taking Ritalin for about a year, and Josh says, you know, do you choke on the pill? No. Do you become a different person after you take the pill? No, it's okay, Josh. Anyway, Josh was crying as he was talking to Dennis, and he gets off the phone, he stops crying, he says, okay, I'll take it. And throughout his elementary school, he took Ritalin. When he got into high school, he decided to stop, and we, weren't going to push the issue. He did very well in high school academically. I think he just floated along. He didn't really need the Ritalin. I think it would have been easier with it. And then he went to college. And incidentally, in high school was when, I think it was in high school that he started seeing Linda Barniscus, who is Ed's wife and co-professional. They do ADD coaching, if you're not aware of that. And my son was having a bunch of issues in terms of his self-confidence and what to do with his life and goals and all that, and college and not college. So we said, you know what, ADD coaching would be good. And the way I came across Ed and Linda, being in the mental health field, I just started calling around people, and almost by happenstance, somebody mentioned they had just gone to a conference down in Ocean County, and Linda Barniscus was speaking there, and they were very impressed with her, et cetera, et cetera. And then I realized they were right here in Marlton, and we got in touch with them. Try to condense this. My son did initially apply to, he graduated high school with honors, but he had no self-confidence, so he applied to go into a automobile maintenance program sponsored by GM along with Camden County Community College, and he was going to be an auto mechanic, which was a little bit disappointing to us because my wife and I both have our master's degrees, and for us, education, we felt, was something we wanted to see our kids get. But we understood that that's what he needed, so we said, fine. And then one day I'm driving along with Josh, and he says to me, Dad, I need to tell you something. I said, what's that? I need to ask you something. I said, what's that? He said, would you be angry if I told you that I don't want to go to auto mechanic school? He said, I'd rather go to college. I said, why should I be angry? That's great. So on a whim, we went up to Maine on vacation, and it was a rainy day. We happened to be near the University of Maine in Farmington. They have many campuses. And he decided to take a look. Well, University of Maine in Farmington used to be what they call a normal school for teachers. And they had a predominance of women students, and they're looking for men, and he was a bright kid. So we did a day visit, and by the end of the day, we were already having stuff faxed to the school to get him accepted, and he made up this impulsive decision. And he got accepted, and he went to the University of Maine for one term, did straight A's. Went into the second term and unfortunately got sick with mono and strep to the point where he wound up in the hospital for 3 days. That's how bad it was. And he dropped out. And then he went on to Stockton College. He was there for about 3 terms. Dropped out in the middle of the term because he didn't know why he was there. He majored in poli-sci because he liked the poli-sci teacher. He was impressed with the teacher, but he didn't like poli-sci. So he didn't know why he was there. Plus, throughout college, up to that point, he was not taking any medication. And he was not sure how much to study, so he wouldn't fail. He never thought of succeeding well. He thought of failing all the time. So he burned himself out, literally. He spent so many hours studying and hitting the books, he literally burned himself out. Dropped out of Stockton in the middle of the term, doing straight A's at the time, and ultimately wound up at NJIT, where there was a program here in Mount Laurel, which recently closed, unfortunately. And he went in, he liked computers a lot. We went to an open house, and he decided computers is something that interests me. And he graduated one day before my daughter, who's 3 years, 8 months younger. She went straight through college. But he graduated one day before her from NJIT with a major in computer engineering, which he ultimately felt was too easy, so he's actually working now in electrical engineering. And I know I'm bragging when I say this, but it also gives you an idea of how well he did. He graduated at 3.97 CUNY. And he kept thinking he was stupid. So for Josh, the medication was extremely beneficial, especially in college, because that's where he hit a brick wall. That's where his innate intelligence just couldn't carry him through, and his organizational skills were problematic. In terms of finding the psychiatrist, in this case the psychiatrist to prescribe the medication, there again I did networking. I worked with a woman whose daughter was ADD, and she knew this psychiatrist who was excellent in her opinion. And she also had, this woman I worked with also had worked with the psychiatrist at a mental health center. So she knew her that way, and she knew her from the help she gave her daughter. So I took her recommendation, and Josh went to see her. Actually, before that, he saw someone else, and that was not a good fit. And that was when I started looking for him. So he doesn't see this person often, but he gets medication. He's taking, and he has no problem with me telling you this, he's taking Adderall at this point, and he also takes Prozac, 20 milligrams, because he has some comorbidity, which in his case is obsessive compulsive thinking, and a little bit of depression perhaps and anxiety, but so he takes those two medications. I got involved again because my son dropped off the board, and Linda and Ed sort of drafted me. But about 6 years ago, I guess, I went to a conference and heard Ed Hallowell in person, and Linda Rady, I think is Nancy Rady, who is John Rady's wife. And John and Ed Hallowell are both psychiatrists up in Harvard. They're both ADD, and Nancy is ADD with learning disabilities. And I went to this conference because I wanted to learn more about my son, and I walked out of the conference and I sat in my van with my wife next to me, and I didn't start the van up right away, and my wife said, "What's the matter?" And I said, "I don't know." And I started to cry. And I said, "This explains a lot, what I heard today. This explains why my life has been so tough. I never thought of myself as ADD. But as you know, I think you probably know, it runs in families, and the apple, my son, fell from this tree. So I saw Linda for an evaluation, and you know, all the indications were that I have attention deficit disorder. And I say it that way because part of me still doesn't want to accept that, and I still don't want to believe it. But I do know I do have it. When I take a piece of paper at work and put it down, and then take another piece of paper and put it down on top of that, and somebody says, "Barry, I need you for a second," I come back and I'm looking for half an hour for that piece of paper, I mean, that tells me something. I personally am not taking medication. I have given it some thought recently. I might consider it. My own thinking is if it's not jeopardizing my professional job, I'm not going to worry about it. I do take medication for depression, anxiety, and obsessive compulsive disorder. Those are the comorbidities I have, and I've dealt with depression my entire life, and anxiety as well. The medications have been very helpful to me. And I see the same psychiatrist, I'll see her, I get the medication from the same psychiatrist my son gets his medication from. So that's my story, and I will say, obviously, to all of you, I've come out of the closet, and I did this about a year ago, and felt really good about doing that. And yet I sit in my mental health clinic, and I hear some of the professionals there talking about, "Whoa, you better get some medication for yourself, Mary," talking to another staff person, "because you're losing it." And I get some attitudes, and a few people where I work know that I take medication. I don't go broadcasting it, but it's a shame that there's still that stigma attached to it. And I just thank God that my wife had the perception she had and pushed me enough to have my son evaluated, because I'll end it with this. Our next door neighbor, they moved in a while after we did, as 18 years ago. They have two sons. One son's a year younger than my son. My wife and my wife is an MSW, also has done mental health work, and she knows a lot about ADD because of the experience. We took one look at this kid one day after he moved in, and we both looked at each other and said, he's ADD. And this kid was bouncing off the walls. And we tried subtly to get that across to the parents because we didn't want to step on their toes. And 10 years later, they realized that maybe he should try medication. And this kid is a bright kid. He's working in basically a dead-end job, and he still refers to himself as lazy, stupid. So early intervention is the key whenever it's possible. And I'm sorry if I sound like I'm lecturing you, but I just needed to tell my story, and that's the way I tell it. So that's my story.
Or that they're not very different from their own story that you could probably tell. What we've come up with is, you know, how do you get to the professional that's going to do the right job for you? And I talked to other professionals, talked to other people that have had similar experiences. I mean, that's pretty much the way that we did it. And there's also trial and error part of this too. Some people don't like to leave their current positions, and you really need to be able to make a good judgment. You know, maybe this position has been good for my health so far, but does he have the expertise that I'm looking for to deal with something specialized like ADD? And if you don't feel comfortable, then you really do need to look for someone else. Some people will, some of the people we work with will come in and they'll find out that they have ADD, and then they go to a different physician to get the meds set up, and then transfer it back to their regular family doc, so that you can do it that way also. One of the things that we came up with were some questions that we felt would be real important for anyone to ask their physician or a psychiatrist or social worker or a learning consultant or a psychologist. You know, anybody that's going to be working with you either as a treatment person or even as a coach. We felt these were important things that you should ask, and if you ask these questions, you'd be able to then maybe compare that individual to other individuals so you can make a better choice. So what I want to do is just pass out these. First question that you should ask is how do you determine ADD, learning disabilities, and comorbidities? Now, what's the process that that professional is going to use in order to determine if these things are present? You know, are they going to interview you? Are they going to do some formal testing? Are they going to get information from your family? Do they want past history? Do they want to do some medical workups, blood work, things along those lines? You know, and you need to find that out. The other thing down here is length of time. And Jan, I think, really mentioned this, the thing of length of time. You know, some professionals, you can walk in their office and in 10 minutes they'll make a diagnosis. If you're comfortable with that, that's fine. Other times you may have to go to someone who the length of time that it would take them to do a diagnosis might be 2 hours, might be 2 days. And again, it depends on what you feel comfortable with and how much data you think is going to be needed in order to back up the diagnosis. Why is it important to get a correct diagnosis? Does anybody know?
It could be letting something else go and getting worse, or you think it's ADD.
Okay, yeah, you could think it's ADD, and it may be depression, it might be bipolar. Okay, it could be a variety of different things. So you want to make sure that, you know, first of all, it's going to be correctly identified. If it's not identified correctly and it's treated, if they identified bipolar as ADD, then the stimulant medication could exacerbate some of the bad parts of that bipolar. Okay, and it's important that, you know, they know exactly what they're doing in terms of this. Why would you want to know if they can factor out learning disabilities and ADD and comorbidities? Why would you even care about that? Especially being an adult, what do you care if you have a learning disability?
Well,
Function, continue life.
All right, yeah, if somebody has active working memory problems, you know, they tend to lose things, forget things, misplace things. Well, that's the type of memory problem we see with many, many adults with ADD. They tend to have a high IQ, but they have a little tiny active working memory. And it makes them be very bright, but then they can't remember where they put the car keys or where they put the paper, or they can't remember what they just read sometimes, or they have difficulty following auditory directions. You know, they hear them, but they just can't remember them. And obviously all these things have a negative impact on your life. And if that's what's happening, then there are certain compensatory strategies you can use, and there's different interventions that you can use. So obviously that's how a learning disability can impact you socially, but it's also going to impact the way you raise your kids. It's going to impact the way you get along with your spouse, and the way you get along with other members within the family, people at work. And you know, it goes back to the old adage, the reason people lose their jobs is not usually because they can't do the job. It's because they don't get along with the people. That's what it's really about. The next question that we had, and if anybody wants to pick up on any of these, just please do, is what percentage of your practice involves ADD? Why would you want to ask that? Yeah, sure. You want somebody who has experience in this. You're right. You wouldn't want to necessarily go with someone that has 2 or 3 patients that are ADD, unless there's another reason for you being there.
the other thing is there's so many new developments all the time that if somebody isn't really involved in ADD, they're going to miss a lot of new research probably.
Okay, exactly. Yeah. So if they have a lot of patients, there's a better likelihood that they'll maybe up better on the research. And the next question we came up with is what percentage are children versus adults? Why would you ask that? Same reason, pretty much so. Yeah. If you're an adult, you would want to find someone, I would think, who has a lot of experience working with adults. Some of the physicians will work with the entire family, and that works very well because you know, we find that once you get meds kind of titrated for one individual in the family, it's a heck of a lot easier than to get the other members of the family titrated because you know they're all related. Another question that we came up with is how long have you been involved with treating ADD? So not only how many patients do you have, but how long have you been doing this? And again, this should be critical information in helping you decide if it's the correct person for you. The next one is what training or educational background do you have in ADD and LD and comorbidities? And again, you know, you want to push on this one. A lot of people have claimed to be kind of professionals and experts in ADD, but they really don't have the training and the background in that. So it's kind of a way that you can help factor out if there are any issues with that.
Is there formal training that someone can get done to like more the breed or go to a conference?
Mostly it's going to be conferences. There's a couple courses out there, but I don't know of any regular courses studied that would take you right through specifically ADD. You would want to look for someone who has, I think, experience obviously with the medications. It might be helpful also to find work with someone who has experience in head trauma. You know, because ADD is a frontal lobe dysfunction as part of the brain here, and if these are damaged, so psychiatrists sometimes or neurologists will have pretty good experience with head trauma, and that can be very helpful also, helping distinguish from medications.
Yes.
Sorry.
When you're saying this and on these questions and everything to answer, I think I've had a problem. I went through like my health care providers who, you know, I have, and I called neurologists and I said, do you take on, you know, children with ADD? I happen to be diagnosed with ADD, so I thought, well, I need to further my investigation with my disease here and get it worked out. And I went to the neurologist and then I called, like I said, I've been calling neurologists, oh, we're not taking any new patients, or we're not taking children, or the children have to be this age. I said, well, how about adults? Then I called another, I figured, well, my medical doctor, I left the neurologist, my medical doctor's been doing the up my meds and checking, and I check with him periodically. So I thought, oh, so I called a different neurologist, I dead end in this area, I just found a dead end. And then I started calling the psychiatrist on my healthcare providers, thinking that that's where I should go next, because where do you go, like, I don't see that as a question on here, where do you go for the resources to find people, or who do you look for? Do you look for an MD? Do you look for a DO? I mean, but then if we just have to go like a shot in the dark sort of, then I could be on the phone forever, but I just feel that where I've been, calling a couple of the local neurologists that I called, I got nowhere. Then I called the psychiatrist and I still didn't get, it was like, did you have someone that specializes in ADD? Well, not right now, you have to call back. And it's like a dead end street. Like, all these questions are wonderful, but who are you asking? I have nobody to ask. That's,
And you're asking, how do I find out who to ask?
Yes.
And the way you find out who to ask is by coming here.
Okay,
Or
well.
to places like this, us or Chad or other organizations, because then you have all these people that have had some experience, and then you can poll them and find out. And that's where this networking that we're talking about really comes in. And does it matter if it's an OD, an MD, and
Psychiatrists or
psychiatrist,
neurologists or.
and my personal experience, no. Okay, what matters the most is their experience with it, because there is no real formal training program for this specific strand. And the other thing is their commitment to it. And by commitment, if anybody in their family is dealing with it, many times you'll find the physician has much more dedication to it.
Now, are we allowed to, am I allowed to say, in this room, does anyone know any healthcare provider
Sure.
that are
Sure, yeah.
really good?
Yeah.
So there are, okay.
Oh, yeah, and feel free to, when the meeting,
Okay.
comes to a conclusion, to ask that question, and get around and to talk and write down these names and give them a call, and that's
That's the networking.
yeah.
Yeah. Another resource you might want to look into is ADDA was supposed to be updating their website, and there's a directory of professionals. It's searchable now. Supposedly it's searchable now. So yeah, the website is ADD.org.
Now, WebMD has a list where you can get the same thing, only it's just all local.
Are they specifically ADD?
Yeah, it's specifically adult ADD.
Okay.
Adult
Well,
ADD.
ADDA is an adult ADD organization, so.
That's even better.
Yeah, and these people are basically they're paying to list on the ADDA, in the ADDA directory, so.
This list comes from Lilly, so that's interesting.
Now, there's no guarantee that those doctors in that list are going to be members of your, part of your health plan. Sometimes you have to go outside the health plan.
Right, I understand that, it's just.
Well, and that's another interesting thing, but that's true many times too. Many people in this area who have been specializing in ADD are not part of health plans because they don't want to have to deal with all the issues that the healthcare industry puts them through, to be honest with you. And it's also not economically appropriate for them. They lose money being in healthcare, especially if you're capitated. That means you have so many people under this healthcare plan, and then it doesn't matter if you get 20 or 30 more of them, you just get paid that X amount. So it doesn't matter if you see them once a year, or if you see them every month, like you need to do, for the prescription. So.
Yeah, I'd like to add something. In addition to experience and recommendation and commitment, I like to also think of the philosophy the person has, because there are different medications. If somebody with ADD is going to try medication, there are different medications to try. And generally, it's accepted that the stimulant medications are the first ones to try. But then you may get a doctor who has a philosophy, I'm not going to start somebody on a controlled substance, because it's more of a pain in the butt for them. And there's also been a lot of pressure politically, so to speak, informally, whatever, brought upon practitioners to stay away from those drugs and getting people hooked and all that nonsense, because it is nonsense. If you have ADD, these stimulant medications work for you, and you don't get hooked on them. And in fact, a lot of people who don't get on these medications get themselves hooked on other things because they're self-medicating. So I recommend you think about the philosophy. And a lot of doctors, some doctors are swayed by what the pharmaceutical companies tell them. So the pharmaceutical company will say, well, Strattera, that's the drug of choice for ADD. Now, Strattera is one medication in an armatorium of medications. It doesn't necessarily mean it's the best, and it probably, and I'm not a doctor, but it probably shouldn't be the first one tried. So philosophy, I think, is something to think about too.
The next question we have is how do you include the family in assessment and treatment programs? And again, we feel that that's very, very important, that there needs to be some input. We learned early on that the worst person to evaluate the medication is the person taking the medication. You really need to get someone else outside of you to give you feedback on how the meds are really working, because we tend to gauge our behavior on how we feel, and how we feel may not be congruent with how we act also. So again, that's important to see what their philosophy is on that particular point. The next one is, what's your method for titrating medication for maximum results? Ask this to the docs and you're going to blow them out the window. But this is, you need to know this. How are they going to determine, number one, if you got the right meds, and number two, if you're taking the right amount at the right time? And quiz them on that. Ask them that question. You know, is it going to take a number of visits in order for us to get these meds right? Is there going to be testing involved? What are the length of the visits? Do I need to get feedback from other family members, from my employers? You know, all that stuff. And again, if there's anyone in here that went to the doc and got their meds right on the first try, bless you, because it's rare. It's very, very rare. The other part of this is this next question, which we think is very important. How often do I get reevaluated once effective dose has been determined? You know, once you get on the right dose, how do you know that that's going to stay the right dose year after year? You know, and we don't know that. We really don't. So what's the process they're going to use to let you know if those meds are still working the way they're supposed to be working, not how we think they should be working?
Let me interject on that too.
Yep.
That's very important, especially in kids, okay, children that are growing up and then they start going through changes in life. Their chemical imbalance is going to affect that medication. Like right now, with my wife now, she's going through menopause, and it is playing hell with her system. So the doctor had to change her meds a little bit. You know, instead of being on Ritalin, she's on Concerta. And they had to change her Prozac to something else, I forget. But whatever it was, it came out, and it all of a sudden it settled out a little, because she was going batty there for a while. But now it's kind of evened out. But
my experience with doctors and medication has been their idea of titrating is saying, well, how you doing on it? Okay, all right, well, we'll keep it the same then.
right. That doesn't work. Right. That does not work. I can tell you that.
Not a thorough evaluation.
In fact, when my wife was evaluated, well, she came back and you tested her like each month. Mm-hmm. And really, it's the same test, but you know, you're ADD, you're not going to remember the answers. and I remember when Ed showed me the graph, you could see where, here we got it. It was like these lines going up and down until all of a sudden they were all pretty much. And then I could see the difference.
Yeah.
It was like light bulb. And that we kept at that for a long time. Yeah. Long time. It's only been since you started menopause that it's changed it.
What he's referring to is a process we use, but it's a process we advocate for everybody to use. We do a baseline on you of your performance before you start your meds, and then we reassess you on the meds. Then you can see, are these meds helping, and if they are, where are they helping, and where are they not helping? Okay, because sometimes you can get a response to the medication, which is good, it increases some skills, but hey, you don't need those skills, you need these other skills over here, okay, in terms of the ADD. So maybe it enhances your listening, but your fine motor still isn't quite correct, so you can't write down quickly the things that you hear, so you forget them anyhow. So again, it's important to know what's happening with the meds. The next part here is coaching part of treatment, and how does it work? And you really need to ask the professional that question, because, you know, honestly, we found that ADD, you can take the meds, and the meds may balance your neurological system, but they don't change your behaviors. So you can take the meds, and many people will get balanced neurologically, but then they wind up getting depressed because they keep repeating those mistakes again and again. And with ADD, it's important that someone work with you, a coach or whomever it is, in order to establish these new behaviors, or else they won't be there. They just don't naturally develop. A good example would be kids that have had ADD through school. You know, they can't sit still and pay attention. Well, they don't learn to take notes for the most part either. Now, if somebody doesn't teach them to take notes, they're never going to learn. They'll never be able to take notes. And it's not a function of the ADD, but it's a direct correlation, you know, to the ADD in terms of how it impacts you. So again, coaching is important because ADD impacts all of your life from the moment you get up in the morning to the moment you get up in the morning, literally. Okay? It never goes away. It's always there. Organization problems are going to be there. If you're ADD, you're prone to thinking certain ways. We tend to think black and white very frequently. Many of us don't even realize it. We think in terms of either or. Either I'm going to paint my house and paint the whole thing, or I'm not going to paint it at all. It never occurs to many of us, so you can do it in steps. Yeah. And tends to be very concrete in thinking. Don't get it. You know, a lot of people with ADD don't get it. You tell them over and over again, and they don't get it. That's a function of frontal lobe disability. So again, how do you get them to get it? What can you do? So coaching can be critical, obviously.
Well, you need to be retrained.
You need to be retrained.
Because when you're ADD and you're unmedicated, there's a lot of things that you can't do, like organization or remembering things, or, you know, putting things in files in the right place. Because you are now on medication and you're thinking, wow, this is great, you never learned their skills to begin with. So what makes you think they're all of a sudden going to be there? So that's what a coach is good for. Coach is going to fill you in with all these things you missed. And it makes you feel good about yourself.
Yeah. But they'll also give you the critical feedback that you do need. You know, your spouse is probably the worst person in the world to be a coach for you. And they also have their own baggage that they bring into this. So, number 9 says,
I had a question.
Yes,
comment.
sorry.
In your experience, have you been able to treat someone with ADD simply through coaching without medication?
Yeah, but it's not as effective as the medication. The most effective is the medication and the retraining, call coaching, whatever you want. Those two together. All right? You can do it the other way, but it's very, very difficult. And you see more regressions the other way without the medication, you know, because you're not balancing the neurological system.
And a lot of coaches have been trained to treat people with ADD. I mean, usually part of the coaching process is to help you, you know, regulate your medication schedule, make sure you're following. And most ADD coaches understand that it's a neurobiological disorder, and part of the treatment, not the entire treatment, but part of the treatment certainly is medication.
The next question is, if I use a coach, would you be willing to communicate regularly with them? Would you consider their input in titrating medication? This is a very, very important question. Some docs don't want to communicate with anyone who's not a professional for whatever reason. Other docs have no problem with that. But going into treatment under someone's care, you need to know if they're going to utilize your coach if you have them. If they don't utilize your coach, I think they're missing out on a whole lot. I really do. So the communication back and forth between the coach, who's going to be helping them titrate you on the medication, at least your behavior, and the doc is going to be super, super important. And this can be done through writing, it can be done through phone call, it can be done through a variety of different methods, but we feel very strong that this is a critical part of treatment. Next part is the legality issues. You want to know if the person who's going to be treating you is familiar with Section 504 of the Rehabilitation Act of 1973, and if they have a willingness to interact with school and/or the workplace and/or your significant other. There's times with ADD that you're going to need an advocate. If you need a 504 plan, which is modifications and accommodations, if you have ADD, you can get your 504 plan in elementary school, middle school, high school. You can get it in college. You can get it in graduate school. If you go to medical school and you want to take your MCATs to get in, you can get extended time on those. You want to go to law school, you can take your LSATs and have extended time in order to get in. If you need extended time to respond during evaluations in college, you can get that. You're entitled to that. On the job, you can get 504 accommodations. You can get extended time for evaluations. You can get other things that you may need, a quieter workspace or less distractions. So 504 is a very critical law to be aware of because it's a civil rights-based law. It comes out of the whole civil rights movement. And what it says is if you have ADD, you have a handicapping condition, and if that handicapping condition interferes with your ability to perform life tasks, then you have the option of receiving some accommodations without being penalized for it. And if you don't receive those accommodations and you're entitled to them, then you have the right to sue that person as if they discriminated against you if you were of another color or of another religion, etc. So you can take their house, literally, you can take their car, literally, in some of these situations. What is the cost per services? Obviously. You want to know what you're going to be paying for the services, and you want to know if they're covered by insurance. And we mention that because some individuals do adhere to the insurance and other people don't. So you need to know that obviously up front. This is the last question that we came up with, and I think it's one of the best questions. You know, why should I choose you for my treatment? And I doubt very much if any doc has ever really been asked that question. But I think it's a very, very important question. You know, you got to realize you're hiring that person to help manage your life. And if you don't get along with that person, if in 5 minutes you don't connect with that person, get out. Because if you don't connect within that first 5 minutes, you're probably not going to connect at all. And if you don't feel secure with them, get out. And you also have the right to fire them at any time you think they're not doing a good job. A lot of us get kind of hung up in this, I don't know what it is, maybe it's conditioned, you know, this kind of worship of the doctors, know-it-all. They have all the answers and we have to do exactly what they say. You have to trust your own judgment, I think, in these things.
Ed, that's it. See, my wife's out.
It's the Marcus Welty.
If you look at a doctor, if you go to a professional, not just a doctor, a lawyer, whatever, she more or less looks at him as like a god or something. And you know what I tell her? I said, straight out, I said, hon, I'm paying the bill. Because she'll say, why did you say that to him? Huh, he's working for me, I'm not working for him. And that's the way you have to look at it. If this guy's going to manage your life and make it better for you, you can ask him any question you want. You're paying the bill.
And if you've been with someone for a while and your life isn't getting better, and that's why you went to that person, you have an obligation to yourself to check it out and see why, or else move on. And sometimes it takes that process of going from doc to doc to doc before you finally get to the one that's going to make things work for you. And I think you have to not be afraid to do that, to look around, to shop around, to try to. The recommendations that we also came up here is when you're going through the process, stay centered on you. You know, that's why you're there, for you. And if you can't see this direct benefit to you in this relationship you're going to establish with this person, then get out. Literally get out.
And let me add something to that. Stay centered on you, but also see if the professional is centering on you.
Yeah.
You know, because sometimes you go to docs and they want to tell you about, they want to impress you with all the things that they've done professionally, whatever, or they're just chatting about whatever. And if they're really not, if you don't feel you're being listened to, then you're probably not being listened to. And if you're not being listened to, how can they possibly help you?
whoever it is, doctor, MD or not MD.
Our next point we came up with is be a student and educate yourself. Well, you're all out here tonight, so we're kind of preaching to the choir. That's what we're kind of used to. But you do need to educate yourself as much as possible. Coming here to ADDventure, going to CHAD, going to other organizations is the best way I think it is to get the information, because you know you can search like you were trying to search, but within a minute after you made this connection, then you have the website, you have these other addresses, you know, you even have the names. So this type of I guess, sharing of information is real critical. You can get information by reading, you can get information by talking to people, etc. Next recommendation we have is network. You cannot be in isolation and be successful in getting ADD treated. Unless, it's like hitting the lottery, if you are. It really is. You have to be proactive in this thing. You have to learn. You have to reach out for others. And part of that process is being comfortable enough in yourself to say, I have ADD. And that's part of getting better for yourself also, is being able to say that. Next one we had down here is trust your instincts. You know, many ADD people are hypersensitive. Hypersensitive maybe to touch or to sound, or you're hypersensitive if you get distracted by that noise that's up there running in the background, you know. And we tend to be hypersensitive in terms of our feelings and our emotions too. So we get our feelings hurt, maybe when they shouldn't be hurt sometimes. But what we're saying is trust these instincts also. Okay, if you get a little message that says something's not right here with this person, then listen to that, because 99% of the time your gut doesn't lie. It really doesn't. Next thing we had was the 5-minute rule. 5-minute rule we mentioned a little bit earlier. In 5 minutes, if you don't connect with the professional, get out. That's our recommendation. You can do as you choose, but we find that if the connection's not there in the first 5 minutes, it usually does not develop.
Yeah, but a lot of people with ADD talk for the first 10 minutes.
But, yeah, they do. But they also have those instincts. Next is don't get stuck on your doctor. This happens to a lot of people. They get with the doc and they accept the word of the doc as gospel, and the philosophy of the doc may or may not match yours. And that's why Barry mentioned finding out what the philosophy is in terms of treatment, things like this. You may have a very conservative doc that doesn't want to treat ADD. Is that the best for you? You need to decide. Family must be included in the treatment, and again, we're finding over and over again that without that input from external sources, it's very difficult to treat the ADD. Why? Because first of all, your behavior has a direct impact on your family, which then has a direct impact back on you. The other part of it is, as Barry mentioned, the apple doesn't fall far from the tree. So if you have ADD, there's a darn good possibility that there's other people in that family that have ADD, including your children.
Can I just interject something?
Yes.
I know some people say, well, I don't really have the family available to do it, or it's not appropriate. I have little kids, or my husband's not a good one. We have found also that when comfortable, we have your peer group come in, we can have your coworkers come in. I've had a high school senior who actually brought in 2 of his friends and said, you know, tell Linda whatever you want about me, because I know I need, you know, this is something I'm still not getting. And he left the room, and for 1 hour, the 2 of them just sat and told me everything about his behavior at school and what was wrong and what they, you know, were upset about. I actually had a man bring in his, he's a lawyer, and he brought in his paralegal, and he brought in his secretary. And he left, he says, okay, you got them. And then he had me come to his office, and he said, you've got them. And he left the room, and they just talked and told me all. And then when you go back and you work, you can now make some changes that you need to make, because you have it right. And they sometimes say, oh, they said that, I didn't realize that. Oh, I didn't know that bothered them. I thought they liked that. I thought that was, you know, the one liked to tell jokes, and he would leave and just go out and start telling them jokes. And they would laugh because they felt they had to, he was the boss. But they said he constantly interrupted their work, and then they didn't get out of there till late. And but he thought it was just really a wonderful thing to do, you know. And so it's so important, you know, because he told me work was fine, that wasn't the problem. And then when you go in and you meet, it was the problem, but he didn't realize it. So it's really critical to get information from significant others, whether it be family or employers or coworkers.
The last little bullet that we have down here is celebrate your regressions. And what we mean by this is that, you know, if you have ADD and you change your behavior, it's like going on a diet. You know, on a diet, if you graph it, you lose weight because you're on your diet. But what happens? You don't keep losing weight. You know, you sneak a couple donuts or whatever, and that weight goes back up. Krispy Kreme. Anyhow, it goes back up, and then you get back on the ball, and then it goes back down again. Okay. Well, ADD behaviors are like that. You know, you start getting extinguishing some bad behaviors and some good behaviors coming in, but that's not curing it. It doesn't get cured. You're going to have a regression in there. You're going to go back to those old behaviors. It happens to everybody who has ADD, and it happens over and over and over again. So you have to be aware that you're going to have these good times, and then there'll be a regression. And when you're in that regression, it's critical, all right? And it's not a failure. And you shouldn't look at it as a failure, because when you regress, you have a choice. The choice is, I can go back and be the way I used to be, or I can stick with it and keep trying to change my behavior. It's kind of like visiting the old neighborhood. You know, if you've ever lived somewhere and you move out, well, yeah, you like to go back and visit once in a while, but you don't stay there. And that's the way you need to look at these regressions. So if you're living with somebody who has ADD, don't expect it to go away, but expect it to get less in terms of frequency and less in terms of intensity over a period of time. And we make a mention there that you're not learning unless you fail. So if you have ADD, you probably had a lot of experiences with that one there. But you have to look at it in a positive light. That if you do something and you're not successful, and if you can change your behavior so you don't repeat your mistake, that's a big win, big win. The last thing we have written down here is from Gene. Gene had to leave early tonight, he wasn't feeling well. He stated ADD is constantly with you, therefore you have to constantly work with it. And I think that's critical. It does not go away. No matter how old you get, it doesn't disappear. The intensity gets less and the frequency gets less over a period of time. Any questions about choosing professionals? We've tried to cover a broad,
You mentioned earlier you taught testing. I'm just interested in what kind of testing you do.
Well, the type of testing that we do is we do a baseline, and the baseline is we measure your ability to do subtasks that are similar to things like on the WISC. So we'll use the Woodcock-Johnson for it because it's well standardized. And we'll test you with a picture recall. We'll test your visual recall. So we want to know if you look at something, how well you can remember that. Why is that important? Well, the way that it usually shows up is if you have poor visual recall, you have poor spelling skills. Okay, so you can see a relationship from that. The other things that we test for are a fine motor, visual motor integration, okay, which is critical. And by the way, this is one of the areas that tends to give you the best response, well, not the best response, but many times the first response in terms of the medication is we'll see changes in this fine motor skills, which means your writing is more legible, but it's also easier for you. Other things that we'll look at are like auditory recall, your listening skills. So we'll do that in a variety of different ways. One way is story recall, reads a story and have the individual tell you back information from that story. Another way we do it is with numbers reversed. Say numbers in a forward sequence, and you have to repeat them back in a reverse sequence, okay, which is a high concentration task. Some of the other things we do are some auditory working memory stuff, and that is real critical because that's the one area that we find over and over again with a lot of very bright individuals that have ADD, is that little tiny active working memory. So we do assessments with that, and there's a couple ways you can do that. We also
can I just interject? one of the things we do is visual processing speed, and you want to see an improvement in that, and you say, well, what does that do with my normal life, my everyday life, visual processing speed? If your visual processing speed is down, you're going to miss a lot of things visually. You're going to miss subtle social cues. You're going to be the one that misses somebody raising their eyebrows, or that indication that they're kind of bored, they want to move on. That's going to affect you in the workplace. Slow visual processing speed can also significantly impact your driving ability. You don't process things as rapidly as you should. So you either have multiple accidents, or you're one of those slow drivers who people are going, come on, what's going on? The light's green. What are you slowing down for? You know what? They're not processing it all rapidly. By improving your visual processing speed, so now you begin to process things quickly, all of a sudden now you catch subtle things. You don't seem to be as spacey. You catch somebody raising their eyebrows and say, oh, listen, you tired? You want something to drink? How about some iced tea? You wouldn't have caught that before, because you would have gone on talking and talking and talking in your own little world and missing these visual cues. All of a sudden you start driving a little bit more appropriately. You feel more confident about driving because you're aware, which makes you feel better. So by getting that learning style where it should be, all of a sudden the world seems a lot brighter to you, and you start functioning better. That's, I think, what Ed's describing to you is our medication one, which just takes about an hour, but we also do a full eval, which tells you everything, and that's anywhere from 6 to 8 hours to do, and then you know yourself inside and out. But the other one gives you the basic auditory and the visual, and you can imagine how auditory impacts you. A lot of people with auditory problems, especially active working memory, which Eddie was going into a little bit, they talk a lot if you have an active working memory problem. And the reason you talk a lot, if I had to sit, I have an active working memory problem, and if I had to sit and listen to you talk, I would go, okay, I know what they're saying, okay, and then you would keep going, and then I'd forget what you said in the beginning. So I'm going, no, why are they saying this? Get to the point, just get to the point. And it's not that I don't want to listen to you and I don't care. I can't remember what you said in the beginning, so why are you still going on about this? But if I'm talking, I'm involved. And I now know what's going on, and I feel good. So the active working memory can kill you, but I have a very, very rapid visual processing speed. So that saves me, because if I get talking, I'll pick up immediately if one of you are starting to go. And then I'll cut it off. But imagine if I had poor visual processing speed and a poor active working memory, which a lot of people have. They don't get it. But if you get the medication titrated appropriately and you pull those areas up, all of a sudden they start to get it. But as Eddie also mentioned a little bit earlier, sometimes, especially with adults, we get, after the medication is titrated appropriately, we get depression. Reason being, all of a sudden now, you're getting it. And you go, oh my gosh, I was so stupid. I can't believe I didn't get that. I didn't. And you go, and you have to realize that if you're with a coach, the coach is going to say, great, the meds are working. Oh, I'm so glad you're depressed. Oh, you are? Oh, why is that? Well, let me explain why. And then all of a sudden you leave the coaching session going, well, that makes sense. If you're not involved in the coaching session and that period hits, and the doctor, and you call the doctor and tell him you're depressed, guess what that doctor's going to do? Most of them?
Give you Prozac.
Increase the medication.
Increase medication, take off the medication, discontinue it, let's give you an SSRI along with it. And by the way, just a very quick, SSRIs, which, they're selective serotonin reuptake inhibitors, which are Prozac, Zoloft, Paxil, all of them. What we have found with the testing, although they work great for the depression, the anxiety, they can also really be cognitively blunting. In other words, they can make you stupid.
And if you have an active working memory problem to start with, you have to be careful because it can make it worse. And so then you wind up forgetting and losing things, but since you have a lot of serotonin, so you don't care.
Oh, well.
You just don't care.
Oh, I forgot the milk again. Honey, why are you so upset for? I'll get it tomorrow night. No big deal.
Yes.
Is there any kind of a verifiable diagnosis that, let's say, the government or a college would need to have in order for a child to qualify for this 504?
Yeah. Yes. Yeah, you would have to meet the criteria in the DSM-3 of DSM-4 if the ADHD, or have another comorbidity.
Does somebody give you a badge or certificate so that
No, but they'll give you, usually they should give you a written report. And that written report can usually be submitted to those places, you know, when you're requesting modifications.
Well, I can verify that, the report that you guys provided,
Yeah, does that.
okay, that's
exactly.
what we submitted to Rowan.
Oh, okay, good. Because I have a daughter who's a freshman in college, and last night she was sitting down to do her homework and statistics. And so I sat down with her, and I was looking over and said, "Oh, yeah, I remember." Started going over the stuff with her, and I pulled out a bunch of her tests, and I was looking at them, and she had, I mean, there was 100 in there, there was 90-something, and there was also 65 and 70 in there, you know. And I kind of thought to myself at the time, I thought, you know, this is, that's before I knew I had ADD, you know, but this is kind of stuff you can't really sit through a lecture and miss part of it, you know, and it's going to show up in your test scores. And so I was just kind of, we've never had her diagnosed. As a matter of fact, I got diagnosed as a result of taking my son to be diagnosed.
That's the way it happens usually. Yeah.
And he wasn't, I am, but my daughter is. But she hasn't been diagnosed, but it's real clear to her and I, it's a little something that we share.
Yeah.
You know, because we're on the same wavelength. She knows she is me, and I understand she's me too. So, but if there's a step that I can take to make things easier.
If she gets diagnosed and has a formal paper written, such as was provided by Ed and Linda, then you just take that to the school.
Yeah, there's certain criteria that they look for in paper.
They actually have disability departments at each of the schools. So you just go there and you submit that and you tell them what you need.
And one time in a conversation with him, I had mentioned that she had ADD and she really took me to task for that. She doesn't want anybody to know about it, but somehow I think she's going to have to confront that issue to, maybe get a little additional help that could help.
Well, you see, like my son, he allows me to talk about his experience, but he doesn't go out saying to people I'm ADD. I mean, nobody in college or high school, for that matter, except the school nurse in elementary school when he was taking Ritalin, knew that he had ADD. In high school, some people may have known because when he ran into trouble with some things academically, we went into school and tried to discuss things with the team, so to speak, and we said, look, he has ADD. This is why this is difficult. But in college, except maybe to speak to some of his friends, he never told anybody in college, any of the 3 colleges he went to, that he had ADD. But still in all, in college again, he decided I need to take the medication. So he got the help he needed, and as a result of that, he was successful. So
That helped as far as medication?
yeah, the medication, that's all he got. I mean, he did get coaching in high school, and that I think helped him make the right decision about going to college, along with other things that he was struggling with. But the medication was the treatment that he really needed, and it just sort of fell into place. He was less anxious. He was able to be better organized. He didn't burn himself out. And now he's holding down a full-time job, and he's doing very well at it. So, and he still takes the medication. And his employer does not know that he has ADD. In fact, when he went for the job interview, and then there was a drug test involved, and he stopped taking the medication for a week or so before the drug test because he didn't have to explain anything to the employer. He will get periodic drug tests because he works on high voltage equipment. And he's going to have to think about whether he's going to stop his meds or just tell them. It's no big deal. He's proven himself to them already. So.
Just like to tell a little story that I usually share about adults and disclosure with ADD. I was working with this one guy, and he was the head of a pretty large company. And after working with him for a while, he says, well, I'm going to disclose. I'm going to tell him where. So he goes in, and they have the big conference table, and all of his guys are sitting down on the sides of the conference table. And he gets to the end of the conference table, and he stands up. He says, okay, people, I have something to tell everyone, and they look at him. And he says, I have ADD. And they look back, and they say, we know, and the meeting just went on. So, it's difficult to hide, I guess.
I mean, that brings up an interesting point. I also heard a CEO of a large corporation who has ADD talking about the benefits of it, how many more things he can do, because he can multitask, whereas most of us are stuck in the path of doing linear tasks. And wanted to bring it up, that
Well, it's
it's
critical.
a real benefit for people also.
Yes, and what we do is we help people find out what their strengths are and then help them develop the strengths rather than doing the old way, which was trying to remedy the weaknesses. Because we found if you remedy the weaknesses, the only thing you get is strong weaknesses. You really don't, yeah. So again, if you're a creative person with ADD, many people are creative, many people have good humors, you know, what are other adjectives?
Creativity.
We took a session and just took all
Great,
the
yeah.
input from different people about different positive traits that you have as ADD. And, you know, for the most part, a lot of people wouldn't give up those things, obviously, because they
Yeah,
make them what
that's
they
one
are.
of my questions. I mean, I would hate to see someone I know who has ADD lose that.
And they should.
Because that's their personality, and they are a very fun-loving person, and they're great to be around, and they're energetic.
And that should disappear. If it does, then we need to question the titration of the meds, because he may be on too much medication.
Can also add here that a lot of times you think an area is a deficit,
Yeah.
and we have found that almost every single deficit can be turned into a strength. And a very quick example is I'm a voracious reader. I love to read. And you know that parents all say to worry about their kids or whatever if they don't read. How are they going to do well in high school or college? They have to read. They don't like to read. Well, my husband, who is, it's called ABD, all but dissertation, you know, doctorate, PhD, never read. He doesn't like to read. And I read all the time. And I always thought that, well, I can read. He doesn't, you know. Poor Eddie. We got an article several years ago in the office, and it was something we were both waiting for. And it came in, it was like about 4 or 5 page article. And he goes, oh, great, it came. He says, here, I have a copy. You take a copy. We have time. Go into the, you know, you read it, and I'll read it, and we'll come back and discuss it. I went to my office. He went to his office. And I'm in there, and I'm reading. And I'm looking at it and reading. 10 minutes later, he comes in. He goes, okay, it's really great. You know, and I go, what? I said, I've only finished 1 page. What do you mean? He goes, I finished it already. I said, what do you mean you finished it already? He said, well, I went through. I've got all the salient, you know, parts of it that I need, all the points that are important. And guess what? He did. Because he hates to read, so he's learned how to go through very quickly, get all the important things. He got more out of that article than I'm reading every line. Doesn't need to. It wasn't a novel. Needed to go through and get the important facts. There was a deficit that became a strength. And I have found that almost every deficit you could throw here tonight, bring it up, we can flip it into a strength. But we've been trained in our culture and the way our education system is that it's deficit. You mean, well, someone else always gets here at 9 o'clock. They get here at 5 and 9. Why do you get here at 10 after 9? That can be changed also into a positive. But our system, we don't look at it that way. And I think with ADD and not being able to admit, you know, at this point that ADD is something they're proud of, I always feel that once you're able to say, yeah, I've got ADD and it's so cool. Let me tell you what, you know, you've got it. We have a team panel that we present once a year here at ADDventure. And that's something you should all come to see, because as teenagers get up here, and I remember the last one we had, one of the little girls, she's 16, she sat up here, and one of the parents in the audience said, what do you do? My kid won't take his meds and he's embarrassed in school and everything. She leaned up and she said, tell him to get over it. Nothing wrong with being ADD. In fact, it's, you know, and I mean, I just sat there and I went, whoa. But it's, and you know what? She has no problem. She does really well in school. She's very popular because to her, it's not a problem. It's a positive. It's made her, you know, what she is with a lot of strengths.
Any other questions, any other concerns? Yeah.
I took, in September, my daughter just started high school, so I decided to call a couple healthcare providers for her because I'm thinking, you know what, she's like a clone of me, and I think that she definitely has a little bit of ADD happening there. So I thought, oh, so I couldn't get in. So I thought, oh, this is high school, new happening for me. So I called the high school, and they said, you have to write a letter, blah, blah. I said, okay, let me get the child study team, which I never thought that I'd ever have to even see them and all. But they let me come into the school, and they did some questions, and they said, well, they didn't feel that my daughter kind of like needed like the ADD assessment and all that stuff, because they felt, well, it's, you know, did you ever do it in grade school? And I'm like, no, but all of a sudden it just hit me like, here she is, and I'm thinking she's gonna go through school like I did,
Yep. Yep.
happily, and this upbeat person, and she's gonna miss everything because they think she's okay, like she just gets by, but I think she's got great qualities and great things in her head that I just feel that she's gonna get by because they're gonna think, oh, she's okay. And I'm thinking, I don't think so. I think she's identical to me.
And a lot of kids get passed over because of that. You know, you really need to look at the potential.
But do you think I'm wrong that since I talked to the child study team and I felt, they said to me they didn't feel that she needed to have that 504 or whatever, or go that route for, they didn't think she needed the ADD assessment or whatever. So I said, well, I still think there's a situation there. She's diabetic. So they said there's some things that they can allow for the diabetes. And I'm like, well, I just think I should go past them now and go to get a neurologist
It's not their call, right?
Well, no, they weren't really allowed to call it, but they just said that they didn't feel that an assessment was needed, that her marks, and it was too soon really, because it was only a month or so into school. But I still feel,
What your gut says.
oh, it says,
Go with your gut.
okay.
Go with your gut.
You're not
They-
making
they
an
have,
assessment based on a month.
Oh, no, I'm like, I look and I think, oh,
Right.
here we are. And I feel that she's missing so much.
Yeah, there's
In
an
that
institutional bias against accepting 504s.
If you get her diagnosed, you walk in there and you put that on their desk, she'll be taken care of.
Okay.
Yeah.
School systems don't want to spend money.
School system has
They
to
have to
pay
spend
for
money
you,
with
so
it.
if they feel that the testing's needed.
Why not? No, I didn't have that other diagnosis, so I thought, let me just go through the school system. Heck, I said to them, I said, I don't know, I'm here because I'm thinking that you're gonna be able to direct me. And then after I left, and my husband was with me, and we did they gave us a testing thing for him to do aside and me to do what we thought of her. Well, I said, I feel like I'm answering these questions for me, and I thought, well, you know what? I need to do this another step further because they're like you're saying, my gut, I still feel that way. And I don't want the time to go by. I don't want her to lose out.
Well, you saw what you lost. And you don't want her to lose the same.
No. Okay, so
You need to check it out.
go with your gut. Thank you.
Any other questions, concerns? Okay, what we'd like to do is kind of wrap it up for this evening. If anyone does have any questions or concerns, you know, we'll hang around for a while and be glad to ask. Please talk to each other though, you know, get this networking going.
This is a great list. You should put it up on a website or someplace where people can, no, I mean.
Get it and use it.
Yeah.
Yes, you're absolutely right. We'll do that. We'll have to do that. But
We'll
give,
submit it to Adam.
give a round of applause to these people because they really put it together.
Meeting in December, please come. We've invited all of the past exec members, and we've also invited all of the speakers that we've ever had in the past 10 years, whether or not they'll come. I mean, we're talking about the president of ADDA and everything else, so we'll see if they come, but just hopefully some of them will show up. And we're planning to have a little special. Yeah, it'll be one of the rooms here. Bring your friends, come along because it's going to be
It's a social gathering.
social gathering. Hopefully we're going to have a magician.
Not me, somebody, my son does.
Yeah.
Yeah, I heard from Ben.
Her mom's the one.
Practicing for the parade, you know?
That's well, maybe they need a rehearsal.
That's-
Never know.
Want to perform before a live audience?
Okay, well, thank you all very much for coming out. I really appreciate it. And again, if you have any questions, we'll be here.
Like driven to distraction's been out for a while, but
These women with it, understanding women with ADD, understanding.
Put those in the cookie jar.
Yes, great idea. Yes.
but I didn't know the name.
The gears are always turning. That's what I need. I just need the medication just shuts it off.
Look at Daniel Amen's
Daniel
saying.
Amen's a good one.
Dr. Amen, A-M-E-N, just like I'm Ben. And Daniel, he's out in California. He does SPECT scans of the brain, and you can sign up online free for his regular newsletter where he talks about what's new.
Yes, you want to go back to college.
Oh, I don't know. If you just do a Google search for Daniel
That was
Amen,
about
Dr.
90.
Amen.
90, I guess.
He's one of the few psychiatrists licensed in SPECT scans.
She graduated from Woodrow Wilson. Came.
Yes.
Most of the professionals speak English.
Yes, yes.
But, you know, I tried to.
See, I
As I got, put his name on our email.
AOL, and I put in, adults, ADD.
exactly how I do it.
And then all these things do.
They're talking about, and then you sort of lost the point of the first thing they were talking about.
Thank you for your input again tonight.
If you don't check that. Like, there's all, I mean, they've got internal medicine, geriatrics, psychiatry, neurology, but they're all MDs to they can
My family
prescribe.
doctor's an MD, but he
Yeah.
You ever listen, you ever get a chance to hear Dan Gottlieb's radio program, WHYY?
No.
It's on Mondays at noon. They replay it Sunday at 6 in the morning. But he had a woman researcher from University of Pittsburgh on last Monday talking about a book she's got out on active working memory.
Oh, what's her name?
I'll look it up for you and I'll get it. I don't
yeah.
know. I can't remember. It is on his. It is on the WHYY website, so I can get it from there. She was talking about.
Does this sound familiar? We had this discussion for about 15 years.
Right, that they are not capable of really making.
And it's not just
Maturity.
because how they're brought up, it's like part
No,
of their brain
right.
is not.
That isn't.
got it.
What she said. This is what I found interesting, is that when teenagers, adolescents try and do what are essentially active working memory tasks, they're using a different part of their brain than adults are. The active working memory, and I forget.
See, now, Eddie, you should listen to this. I didn't know that.
That the active working memory
All right.
is, I think, temporal lobes. I'm not sure, but that they're doing like MRIs. What are the MRIs that they can do while they're while they're doing things? And they're finding out that when teenagers are doing active working memory tasks, they're using a part of their brain that isn't designed for that. So they're having to really put out a lot of energy.
Makes sense.
You know what? It makes sense to me because I've known all along that math, a lot of times mathematical abilities, do not develop until you're about 23 years of age. So we're asking a lot of these kids to do algebra, calculus, etc. when they're like 16, 17, and they're not ready for it. And active working memory, they said, doesn't develop until you're about 22, 24. You know,
I'll get to this doctor's name. She's from Kent. Dan Gottlieb had her on his radio show about a week or so ago. She said maybe 15, 20 minutes.
Okay, so you just have this one, or you just tell them that, oh yeah. I know. Well, what you do is you just call them and you need one of these three versions. And the other three are the same size. Don't much like
more aware.
Take it easy.
Does that make sense?
Move. Oh, you're following me? Okay. Just throw this away.
Thursdays so that I can come. Because, I get on the website, not the website, I get on the internet and I go, adults with ADD, and I look for all these places, but you just don't, it's not there as good when you're with real people. And you feel it, it's good.
This is
So-
all within from where we live in Medford. One more second.
Thank you. Thank you. Thank you.
Website works
I'm gonna call and see.
because when my son was going
That's who.
coaching, they were working
Idea of
cooperatively,
that,
going back information, so she works
She
fast.
goes, I wish I was your age, and I'm gonna do it. And I'm like, you know what? Any age, you should do it, because
She would be for medications,
For the medication. And I know this because I gave you $300 3 or 4 or 5 years ago, and I never had.
Are you the one?
Yeah, I'm the one.
Are you
still
Susan?
got my 300?
Susan will know. Just call and she'll credit. She'll credit the 300.
Coming back.
She goes, I can't believe they
Now
get
that is a serious case of ADD.
It is.
Where's that $300? No, I know where it is, but we always, something's always more important. He says nothing's more important, but I say.
You know what you do?
All these years.
How you going to diagnose yourself?
No.
When my wife would go back to Linda, she would take her in a room and test her. Then, based on the test, she'd say, okay, let's take it up to 15 milligrams. Then after she got to, I think it was 20.
Thank you for bringing your wife with you. Bye.
Her experience.
You have to go and get a feel for it. You know, because
She, you know, you look for your daughter or yourself?
me, right now, I'm going to call Children's and see who they have as neurologists and that deals with neurology and ADD.
Okay, that's
Sort of like my corner in my bedroom, in my office at work.
Never had a college course in life. She didn't take college prep. She really didn't have
Being organized comes very naturally to her, and he's like very
she's,
organized when he's with
She's
her.
very organized, talent or something.
Right, but she teaches him too, probably, where he picks up like hang up your clothes. I mean,
But I don't think you would need the full amount.
Yeah. Well, actually, I mean, I feel like things are improving, that I have learned some things from.
Because once we can figure out what your weaknesses are, then we can help you understand why things.
Did you say?
And I gave it to him, and he wanted to do that. He had to repair this, repairs. I said, but I wouldn't have done that unless I had full confidence in this marriage.
That's exactly what I was going to do.
In a conversation or something, or even visually, something around the house, oh, I
I
need
said,
to
well, I haven't
do
seen
that,
the
you
whole,
know.
she's wearing my mother's engagement. Every time I see it, it makes me feel good.
That's right.
Well, I wanted to ask you that about if he's changed living there because.
Like already going through the menopause. No, I get up all the night and I'm like, oh my God, I just look forward to it. Like,
Oh, it's horrible. Let me tell you
and
something.
then
I'm going
tonight,
through it
finding
now.
out that, well, and then you do not have ADD? And you're saying that now you're going through the menopause change and the ADD change, and you're still here.
That's good, yeah, he's good.
I think it's wonderful.
Okay. Well, I turned to get up, right? But she was standing right next to the phone, right? And he answers the phone. It's a wrong number. She takes the phone and brings it over to me. He says, you know, I got 3 reports I got to do on this computer. Next time you answer the phone.
Hi, honey, I'm home.
How are we today?
Good night, all.
Well, we can check it out.
And then I think sometimes just from realizing that I have started to really try to exercise that muscle. Like, you notice it, do it, do something about.
Good night.
After the fact.
Adios, amigos.
How's your baby? It's like, wow.
Adios, con Dios.
Confident, very knowledgeable. I was impressed.
Thank you. Very nice of you.
Mr. Markey, it is now almost, what, 9 o'clock? 9:10, it's 9:10, and getting out early, time to go home, chill out.
Right.
See it? My pajamas on.
You better believe it. Yeah.
It's interesting, you mentioned comorbidity.
Don't worry, you know, so I'm gonna make, you feel better talking to me. Talk to Susan, you might feel better.
So it's interesting you mention it because
So, talk to Susan, she'll explain all of it to you.
She's actually, she won't ever fall, because as far as she's concerned, she's somebody who, if she gets a partial hypercoach, she has to jump out all the hypercoach, face all the six, and they stand up, just leave. And she always has to make sure that nothing that's been rearranged was. Well, I'm not taking anything, which is what they start coming support because I need it's about 8 hours to work, and then it works for about another 36 hours. And I can tell the difference.
You need to really work with the doc, really give some meds, because, you know, he may have you do that. That when you have these onsets, that's when you're like, okay, the rest of the time,
Well, you know, they say, well, you have to start taking it once you 2 weeks, builds up your system. That's, I mean, you could have placebo effect. I could take that thing and then say to myself, I'm safe.
That would have been a good idea. You know, just where'd you park? I'm down to the right.
Oh, all right.
Susan, we really have to get together, Eddie, before the 5th of December.
Yeah, it's a plan something.
We can't. The 5th of December is,
Trying to plan a big party here, you can't do it on
Oh, I agree.
yeah.
Monday, Tuesday, and Wednesday.
So we were thinking like Thanksgiving weekend, after Thanksgiving?
yes, I think that's what we should do, definitely. We'll
All right.
probably need 2 meetings.
Yeah.
Yeah.
All right, call me tomorrow at the office. No.
Look, get him, get his jammies on. We're talking about it. Let's get his jammies on and.
Oh, is he here? I have to just talk to.
You know I don't talk like that.
I know, but just say, you know, I know you're all
Do you want me to drive you down there, or are you all right?
No, I'm right there. Right there. Very first spot.
All right.
Good. When we were troubleshooting it out